Tonight, Utah's daily COVID numbers remain in the thousands. Health officials reporting another 1,274 cases today alone.
That brings Utah's total case count to more than 485,000 cases. Health officials also report 13 more Utahns have died. One of those deaths was a person between the age of 15 and 24. Right now, there are 581 people in Utah's hospitals battling the virus. For healthcare workers in many of those hospitals, burnout continues to be a major concern.
Yeah, in fact, enough so some are leaving the profession altogether here. News specialist Mike Anderson talked with a former healthcare worker who decided he's had enough. Mike?
Yeah, Mike, Cole Squire, this is not a decision that he takes lightly. He said he wanted to become a doctor, had been a CNA for several years, but last week he quit his job here at the U along with that career path.
Healthcare workers are taking on a lot of responsibilities they didn't sign up for.
At the very beginning of the pandemic, you had people applauding us and celebrating us.
And Cole Squire says that helped a lot at first. He joined University of Utah Hospital over 2 years ago as a CNA to help in the cardiovascular unit. But as the pandemic hit, he took on extra shifts and started helping with COVID testing, all while going to school full time.
Me being in this plastic gown with almost like a hood over my face for 8+ hours, swabbing patients in 100-degree heat, it got hot really quick.
But he says what truly made it tough was the change in patients and their families.
They would kind of spew a lot of very false medical information, kind of being like COVID's a hoax, like you're purposely just diagnosing me with COVID to get more money.
And to have that from people they were trying to help.
It felt like kind of being stabbed in the back. We lost a lot of good nurses and CNAs after the pandemic surge during the winter.
And as the hospitalization numbers started coming back up again more recently.
And the scary part is we don't have the staff anymore to open up an additional ICU or acute care bed.
Squire decided it was time for him to go too.
And Squire is 22 years old. He wanted to be a doctor ever since he's 8. Started working as a CNA when he was 16. Now, instead, he's pursuing a career in international law. Mike, back to you.
Yeah, tough to see, but you certainly understand all that burnout. They're working hard out there. Mike, thank you.